everyone. Welcome back to Clinicians Brief, the podcast, where we get to have the conversations behind the content. I'm your host, Dr. Alyssa Watson, and today I am just delighted to welcome back a familiar guest to the show, Dr. Kate Barnes. Dr. Barnes is an associate professor of small animal orthopedic surgery at Texas A&M University. She's actually joined us twice before to share her expertise on both thoracic limb lameness and pelvic limb lamenesses in dogs. But today we are shifting our focus to feline patients, and we're going to discuss her most recent Clinician's Brief article, which was entitled Top 6 Osteoarthritis Treatment Options for Geriatric Cats. We know that managing osteoarthritis in cats can present some unique challenges, which is why I'm so glad that Dr. Barnes is here so that she can kind of help us navigate the best treatment strategies for these often really underdiagnosed patients, I think. Dr. Barnes, welcome back to the show. It is such a pleasure to have you.
Thank you so much. I'm so happy to be back again. Thank you again.
Oh,
appreciate it.
Yay. I'm just going to let you have just a minute to kind of introduce yourself, just in case someone in our audience wasn't able to catch your previous episodes.
Oh, yeah. So thank you again for the introduction. And like you said, I work with orthopedic surgery at Texas A&M University. In particular, I really, really like cats as well. And I think that they are, kind of the second-class citizens sometimes to dogs. And so I think that they really need the advocates to stick up for them and help managing some of the things that can be difficult to diagnose. And so I'm always happy to see our feline patients at the university and help hopefully make their quality of life even better.
I love to hear you say that. And I will have to say, for me personally, I have always considered myself a cat person. And, I have dogs and I love my dogs. But when we're looking at everything, cats really, truly are one of my favorites as well. And
They
so,
are.
yeah, they're just wonderful. So let's jump into some medications. Okay. So there is going to be a lot of comparison between cats and dogs in this episode. And so, that's one of the things, just like you said, we're always kind of, looking at what we use in dogs and is that going to be appropriate for cats? We know that NSAIDs really are first line therapy for osteoarthritis in dogs, also in people. But their use in cats can really present some challenges, especially with things like black box labels and things that can make people certainly uncomfortable. So how does this impact your dosing strategy? And what points do you think veterinarians really need to emphasize when we're discussing NSAID risk and benefits with our clients?
Yeah, and that's a great question. And NSAIDs really are going to be a good component of treatment, and they can make a huge impact in pain management and quality of life. I think some of the challenging things with cats too is especially as we're treating the older cats, we start to have other concurrent issues like kidney disease, which can make it difficult then to do long-term NSAIDs. We also don't have a lot of options compared to dogs. Dogs have a lot of approved NSAIDs for longer term use, and cats again don't have a lot of great options. Either we have short-term use or we're doing it off-label long-term. And so, realistically, if we are going to do that, it's having a conversation with the owners about risks versus benefits, and then also trying to get them down to the lowest possible dose. So, we don't necessarily want to go at the high dose of an NSAID every day for the rest of the cat's life for years and years. That's probably going to increase our risk for having certain complications. And so, if we can start out at our normal dosing and then start to back it down. So back down our dose or even back down the frequency that it's administered. Hopefully we can get them to the lowest dose possible, maybe even getting them off of it and only using it then intermittently as needed. It might increase the chances that we're able to use it longer term without having a lot of potential side effects. And if we do have things like kidney disease, if it's something that's well controlled and mild, doing other things to help support them, making sure that they're getting wet food, drinking a lot of water so that we can hopefully try to, again, decrease the risk of having issues with the kidneys as a side effect from NSAIDs.
So Just curious, because this is something that I sometimes struggle with when we're looking at tapering those dosages to the lowest effective dose. Is there a strategy that you prefer, like tapering to a lower dose, but still giving every day, or tapering the frequency first, so that we're saying let's give meds Monday, Wednesday, Friday, or something like that? Or does it, depend on each kitty, or whether we're using a liquid or a tablet?
Yeah, that's a great question. And I think a lot of it is probably patient dependent. So there may be some cats that do better with having, even if it's a smaller dose, more frequently, and other cats that may do fine with having a higher dose but spread out the frequency. And so I'll usually just recommend to owners that they pick one, try that and see how it works. If it's not working that way, we can always adjust it and maybe switch strategies. And then as they're trying to decrease, so maybe they start by decreasing the dose, each dose that they give, and then if that seems to be well tolerated, maybe then they can space it out. And if for any reason we get to a point where the cat is starting to have some more recurrence of signs and needs more, we can always pause and go back up again, just so that we can help control clinical signs. And once things are a little bit more controlled, then start to decrease again. So probably a little patient dependent and then also owner dependent as well.
Let's talk a little bit about Frunivetmab, because this is certainly something that our audience has a lot of questions about. I have a lot of questions about anytime there's kind of a newer medication. This is the first FDA-approved monoclonal antibody for osteoarthritis in cats, which is always amazing when we have a totally new class of drugs. How do we think it compares to NSAIDs in terms of efficacy, but also for safety?
Yeah, that's a great question. And I think there's probably still some more for us to learn long term for what's going on with this medication in cats. And I think the upside is that, just like we were talking before, there's not a lot of really great options for cats. And so having this medication as just another tool in our box, I think is really, really helpful. And I have seen some cats do very well on it. I think there has been some evidence coming out that there are some potential side effects that we may just need to warn the owners about and have that conversation. But if we get to a point with some cats, especially the older cats that have some other issues and have a lot of OA and are really having mobility issues, it can get to the point where it really impacts quality of life. And so, as long as we have a conversation with the owners and we monitor for potential side effects, this may be a good option, especially if other things like NSAIDs aren't very well tolerated. And so having, all of it is about communication, and monitoring. And so if this can be a medication that's beneficial, I'm for it having it in, as long as we can make sure that we don't have anything else, side effects happening. And I think probably more information is going to come out within the next couple of years about any other potential side effects and long-term consequences. And then, just like a lot of other things in medicine, we can take that information as it comes and then use that to guide, whether we use it in each individual patient.
Tramadol is another medication that can be used for osteoarthritis pain in cats. Do you have a specific dosing protocol for tramadol? And do you see any barriers to prescribing it? Things like the fact that it is a controlled substance. And so sometimes that might make it a little bit more difficult for clients to obtain.
Yeah, absolutely. There was a paper that came out looking at tramadol in cats with their activity, and their recommended dose that they found most beneficial was 2 mg per kg twice a day. So that would be the dose that I would go for. Um, I think the barriers, like you said, it's a controlled drug, so that can complicate things. It has the potential for abuse for owners. It also is a medication that is potentially hard to give to a cat. Some owners aren't able to pill cats once a day, let alone twice a day. And if it has a bad taste to it, sometimes that can make it even more difficult. So if it is something where we're able to compound it and make it a little bit easier, some cats may be able to take the liquid a little bit better than the pills. That may be a good option. And some of it may just be limited with cats, whether or not you can medicate them during the day. But potentially, it does have potential, I guess I should say, for helping cats if we have the right patient that's able to get it.
Nothing's going to work if we don't get it in our patient, right?
Exactly. Yes.
And then the last medication I want to touch on is gabapentin. Obviously, gabapentin and cats go hand in hand. I know so many clinicians are utilizing gabapentin for its anti-anxiety properties, especially pre-visit and things like that. Are there particular cases where you find gabapentin beneficial for specifically for osteoarthritis pain?
Yeah.
And same thing about dosing. Like, how are you adjusting that dosage if you're using it long term?
Yeah. I think gabapentin may have a role, especially in combination with some other medications. I do know, especially if we're talking about osteoarthritis pain, there's been some mixed evidence, particularly with dogs. And I know dogs and cats are not the same, but um, there may be some parallels that we can draw. And so it's been shown not to be the best medication for osteoarthritis pain in dogs. With cats, again, because we're a little bit limited with some of the medications that we have, it could potentially play a role, and there is some evidence that it might help with some mobility. The other challenging thing, because it is so great for helping with anxiety and sedation, that it may have that side effect. And so titrating each dose for each individual patient is probably the way to go. If you start out at a dose, say 10 mgs per kg, and they're too sedate on it, then you may be able to back off a little bit. Or again, if we think that they're tolerating it well and may need more, then you can always titrate it for each individual patient. So again, it might not be the one that I would choose that's going to have the best efficacy. I think things like NSAIDs are probably going to be a little bit higher on the totem pole. But for patients where that might not be an option, this may be something that we could add in to our arsenal just to help them a little bit better.
I want to kind of step away from medications and pharmaceuticals for a minute and talk a little bit about some other things that we can do to help support these kitties. We certainly see when we have cats with osteoarthritis pain, one of the most common presenting signs that we'll see are kind of behavioral changes, especially I have people bring in cats all the time for inappropriate urination,
Yeah.
and we know that they can have pain getting in and out of the box. So, are there some simple and but impactful environmental modifications that we can suggest to our pet owners to help support mobility and comfort at home?
Yeah, absolutely. And I think that this is something that's really important because, like you said, we have that people coming in, clients coming in with the inappropriate urination. And sometimes it can get to the point where they need to try to rehome the cat or try to bring it to a shelter where they can't have it in their house anymore. So, if we can do things to try to decrease or limit that from happening, I think it's going to help the cat, it's going to help the owners, help with that bond between the two. And so the kind of easiest things that I would usually recommend is having more litter boxes, so multiple litter boxes, and having access points which are low, so easy to get over. And some cats are really individual. Some cats don't mind going into the ones that are covered. Other ones, it might be a little bit more challenging to get in or out. And so some of it might be playing around with the litter box shapes to make sure that you find one that's right for your cat, but making it as easy as possible to get in and out of the litter box. Also, having it in an area that's easily accessible where they don't have to worry about navigating past dogs that chase them or kids, toddlers that chase them, somewhere where it's an area where they feel safe, where it's easy to access. So that hopefully we don't have to worry about them traveling large distances or jumping up or climbing over things that can then exacerbate some discomfort with osteoarthritis.
And then let's talk about weight loss because this is this is so challenging. I mean, weight loss is challenging for everyone,
It
right?
is,
But
yes.
especially kitties, those older indoor kitties. Do you have any realistic strategies that we can help owners achieve, sustainable weight loss in some of these older kitties that don't want to run around and play as much anymore?
Yes. This is definitely something to struggle with, but can make such a big impact on quality of life. If there are cats that like to engage and play with owners, that can be a really great opportunity, even just setting aside, 5 or 10 minutes couple times a day to play with cat toys with them. If they like to interact, some cats like to chase even laser pointers, balls, things like that, just to get them up and moving around. Other things that we can do are making them engage and be active to get their food. So there are feeding toys for cats where they have to kind of work with them to get the food to come out. It engages their mind a little bit and then also makes them a little bit more active to get it. And ultimately, the biggest thing is that's going to help is cutting back the calories that they're taking in. And so really having owners make sure that they're measuring out how much calories that cat is getting. And it can be helpful to have guidelines for the owners of, this is where your cat weighs now, this is our goal, and here's the calorie goal for each day, so that then if they want to do things like treats or do little food throughout the day, they know to subtract that from the total calories for their real meals. And if we can get that cut back and get the cats a little bit more active, then hopefully we can get a little bit of weight off of them. We have rehab facilities too, and I know there are other places out there. If your cat is excited about leaving the house, which not every cat is, and interacting with new people, that might be a really great option. We've certainly seen cats that go swimming and do the underwater treadmill. Again, not for every cat, but those can be really great ways to try to get weight off with kind of lower impact activities, but also keeping them active and engaged throughout the day.
Yeah, I've had both clients and other clinicians tell me how surprised they were that cats really tolerated the underwater treadmill as well as
Yep.
they did. So
Hmm.
it's always something where I find myself, you kind of jump to a conclusion like, oh, a cat would never do that,
Yeah,
but we don't know until we try.
exactly.
Um, I also want to, you talked about calorie control, and really that's going to be really important. Do we have any tips? A lot of these kitties live in multi-cat households.
Mhm.
And so anytime we're talking about restricting or changing the food of one cat, it could potentially disrupt the feeding routines of the other cats. So do you have any communication tips or tips on getting clients on board with a strategy like that?
Yeah, and that can certainly be really challenging if you have multiple cats and you only need to change the diet for one. I would say probably the easiest way would be to make sure that we're doling out the diets for each cat and potentially feeding them separately. Because I think sometimes the concern is the cat on a diet's going to eat their food and then run and try to steal the other cat's food as well, which I would certainly do if somebody else was eating something while I was on a diet. So if we can feed them separately where they don't have access to the other cat's food. The other big issue I think is when people free feed their pets. Not necessarily that that's bad. So free feeding in a cat or a dog that is at a lean body condition that can regulate well works. If it works fine, it works fine. But if we have a cat that is already overweight and we're trying to lose weight, then it would make sense not to be able to free feed the cats in the house, because that cat would then just have access to it all during the day. And so being able to dole out different portions, making sure that they eat separately and then are done. Or if there's a cat that is not the one that's on a diet, but doesn't always eat all the food right away, and you want to make sure that they have access to it, maybe having it in a place where only that cat is allowed to go. Or if that cat can get into an area that's up higher and our cat with osteoarthritis maybe can't jump that high, maybe that would be an option for them, or in a separate room where they like to go. So different ways to try to make sure that they each get their own calorie needs, but trying to limit access to the one that's on the diet.
And then you touched on this very briefly, but I did want to get a little bit more detail on how much play or exercise is recommended for a cat. Are you doing these sessions daily, a couple times a day, weekly?
Yeah, that's a good question too. And I don't know that there are set recommendations for X amount of exercise a day or a week for cats. But I would say if you can do it a couple times a day with the cat, then that would be great. And I think again, if there are some behavior issues, sometimes that interaction that's positive can really help with the bond between the owner and the pet. And so if you're able to do it a couple times a day, that'll probably help with the activity level, with weight loss, but also help with just feeling close with your pet and wanting to spend more time with them.
Yeah, and absolutely we know that, certainly things like keeping them mentally engaged, like you
Mhm.
said, with those play feeders and things like that, can also decrease their stress and may, help with other behavior
Yeah,
issues or challenges that we see. So that's great.
absolutely. Yeah.
If you've noticed your dog having difficulty moving, jumping, or playing, it could be a sign of osteoarthritis pain, or OA pain. OA pain is a chronic condition that impacts how your dog moves and feels. Do you think your dog is showing signs of OA pain? Know that treatment options are available. Ask your vet about what they can do to help control your dog's OA pain. Tap Learn More for details.
Let's talk a little bit about omega-3 fatty acids. So these have shown promise for improving mobility in cats with osteoarthritis. What do we know? How do these findings compare to what we know about the efficacy of omega-3, omega-6 fatty acids in dogs? And should our approach to nutraceuticals be different between dogs and cats?
Yeah, and I think for dogs and for cats, I think if we're thinking about a nutraceutical and a joint supplement, omega-3s are probably the way to go. It seems like those have been shown to have a little bit more efficacy than some of the other supplements that are out there. For cats, again, it's one where there's not as many options as for dogs, but there are diets that are enriched with it, that are joint diets that are available. And so then also other supplements that we can add into the diet. I think with cats as well, some of it depends on the flavor of it and the diet and whether they're going to be willing to eat it. Some cats are a little bit pickier than other, Labradors that might just eat whatever you put in front of them. But I think if we are going to pick one to put in, then these would be a good option. And if the cat is absolutely refusing to eat it, then maybe we can look at other types of things to add in and put these aside. But if every little bit can help. So again, I think things like NSAIDs are probably going to be the best, have the most impact. But everything that we can add in that even has smaller steps and smaller impacts will eventually add up over time.
We can get that kind of ladder effect. So,
Mhm.
sorry, you mentioned the Labrador that'll eat anything you put in front of it, and my mind immediately went to, and anything you try to hide from it or don't
Yes,
put in
yep.
front of
Don't eat this.
it,
That's what he's gonna get. Yep.
that's what he's going to eat.
Exactly.
I think you kind of touched on this a little bit, but I do want to talk about glucosamine and chondroitin because that is certainly one that, seems to be something that most clients are familiar with. There's products for cats, there's products for dogs, there's products for people, but it truly does have some kind of mixed evidence. So, is there a potential downside in recommending those supplements?
Yeah, it is interesting that these are kind of the ones that people think about, and the evidence is not as strong for using them. I don't know that there's really a downside to using it though, and if there's the potential for it helping, and not really any downsides, then I don't have a problem with adding it in. And just like we were talking, if there are little pieces that can add up to help, then why not? It's another one where if it doesn't work out well, they don't like how it tastes or the whatever it is, and they're not going to eat it. I'm not too bothered by it if it's left out, but it may have some benefit, and I don't think it's going to hurt.
Okay. So, shifting to surgically treatable conditions, when we have a dog come in, I have a dog come in with a hind end lameness, and the very first thing I'm going to think about is cruciate ligament.
Mhm.
But my mind doesn't automatically pop to that with cats. What is the prevalence of surgically treatable conditions, in cats compared to what we see in dogs?
Yeah, that's a really interesting question, and I don't know that we know the answer to that. I think there's probably now we've realized osteoarthritis is way more prevalent than we thought in cats. And I bet that there's even more other orthopedic disease that we just don't know about. Cats are so good at hiding problems that even if they limp a little bit and then maybe get better, their owners seem much less likely to bring them in than with their canine counterparts. I think the other challenge with it, sometimes it's mentality from the owners. Sometimes it's not wanting to put the cat in a carrier and bring it in because it's stressful for everybody. And other times, if the cat's just hiding it and then starts to improve, then they may think that things are better and the cat doesn't need treatment. I do think that we're seeing a little bit more cats for orthopedic disease than we were even 10 years ago. So I think owners are starting to realize when there are problems with cats, some of the more subtle signs of behavior changes, that there might be something else going on. I think veterinarians are a little bit better about picking it up now than we used to be. So I think it's probably the prevalence of these diseases is probably higher than what we think. I still don't think we see as many cruciate tears as dogs, so I was probably with that probably a little bit lower than the canine counterparts. But I think there's probably more out there than we're really able to realize and to diagnose.
And kind of building on that a little bit, you mentioned owners may be a little less likely to even bring cats in. Sometimes I find they're a little less likely to consider surgery, as a treatment option, whether that's because of concern about cost or recovery, or whether they feel that there'll be, any kind of long-term benefit.
Mhm.
And so when we're deciding between surgical and non-surgical management, what are some ways that you counsel clients? If you truly believe that surgery is the best option, again, how are we getting clients on board with that?
Yeah. And so some of it, I think sometimes when clients are on the fence, it's when there's the possibility that things might improve on their own. And so a lot of times by the time they come to us at a specialty hospital, they've tried some medical management and then it hasn't worked. And so things like cats with a cruciate tear, maybe if it's just the cruciate tear that's or a partial or something, they'll start to improve. But if we often get to maybe an acute complete tear or a meniscal tear, oftentimes they are having persistent lameness that then really does need to be addressed, and it's not improving with medical management. In those cases, we do have a conversation about the owners, about cost, about the procedure, but then also the post-operative care. And I think some of the post-op care is really challenging for people because we have a cat that's never been confined before. We don't know how they're going to react to it. If they're going to, be calm and just rest like a good little kitty, or if they're going to lose their mind in their crate or carrier or small room and try to destroy the whole area. And I think sometimes owners have an idea from their personality beforehand about what type of patient it might be. Sometimes we don't quite know until afterwards. But the patients that we have where the owners are financially able to go ahead with the procedure and also are willing to go ahead with that post-operative care and work on confining their cat and trying to make sure that they don't slip or jump or anything that's going to damage the surgery, those are going to be really great options for surgery. Sometimes we don't have a lot of other options besides surgery. So if we have a cat with a fracture or something that really needs to be stabilized, those we can kind of work with them on trying to keep them confined. Maybe we can add in some gabapentin to try to decrease anxiety during the post-operative period. I think some people are pretty nervous about cats, but I've actually been surprised with the cats that we've had surgery, pleasantly surprised, I guess I should say, with the cats that have had surgery that have actually gone really well through the post-operative period. So I don't think that we should be terrified of doing surgery in cats because I think that they can still have a very good outcome with surgery and with the post-operative period. It gets a little bit challenging when we have cats that we absolutely cannot touch when they're awake. I think with those, definitely need a lot of owner participation in the post-op period, and hopefully the owner can touch them at home, and it's not just a kind of outdoor cat that they've found that's more feral. Those are certainly more challenging to have in the hospital, but we have had some cats that haven't been as well able to be kind of pet and handled in the hospital that have still undergone surgery and done well in the post-op. So.
And then for those kitties in that post-operative phase, how often do you recheck them? And also, do you find it beneficial to start some of these other, management strategies like we've been talking about throughout the whole episode, like the environmental modifications and maybe the supplements right away? Or do you wait and to see if, clinical signs of osteoarthritis develop later down the line?
Yeah, that's a great question too. And I guess for the first part, the rechecks, some of it depends a little bit about on the age and what we've done. So if it is a adult cat that we maybe did cruciate surgery on or a fracture, we'll usually check in with them, have them back about 2 weeks for the incision check, make sure they're using the leg well, and then back again in about 8 weeks. That recheck will be sooner if they're really young, under a year, and we expect them to heal really fast. We might see them back a little sooner. And I would start some of the other modifications and management for OA pain right then and there. So, especially post operative, or if they have an injury, we know it's going to be harder for them to get in and out. So, we want to, the litter box, so we want to make it as easy as possible for them. So, making sure that we have it on a floor where they can get to easily with a low side, I think is important. And I think it's better if we can start to kind of curb some of the behaviors and try to decrease pain as early as possible. And then hopefully we can decrease the chance of having some other long-term behavioral changes that then we need to try to correct and manage down the line. And certainly we see a lot of overweight cats and dogs that come in. And so no matter what if it's elective or a trauma case, then I'll usually counsel owners right at that point to really start cutting back on the food. We obviously can't increase too much activity if they've undergone a surgical procedure right away, but we talk about increasing that activity over time and at least cutting back on the calories to start that weight loss journey right then and there.
And then let's wrap up with non-surgical patients. Your more typical osteoarthritis, but didn't have trauma or didn't have an orthopedic condition that needed surgery. Maybe you have them on an NSAID or some of these other things. How often should clinicians be rechecking those animals? And kind of what is your minimum database on lab work and things like that you feel should be run for those patients?
Yeah. I think the rechecks depend a little bit on the patient. Usually, if we're recommending weight loss, it would be nice to get updated weights on the patient at least once a month. Again, with cats, sometimes that's challenging to get them in and out of the clinic if they're challenging patients to get in carriers. So if owners have a scale that will read kind of low enough, they may be able to kind of stand on the scale and hold the cat and then at least call in or send in a weight number so that we can try to track it over time. If they are willing to come in and want to come in monthly and get a weigh in, I think that's great too. We can get accurate weights. And then otherwise, if it's just kind of the long-term maintenance, then I typically would recommend doing blood work. If we can get a urine, that's great as well. Before starting NSAIDs, we can check liver values, kidney values, urine specific gravity, things like that, just to make sure that, just to see what their baseline is and then monitor it. If they don't have any other concurrent issues, then I'll do it at least every 6 months. And then if problems develop, then I'll have them call us sooner so that we can reevaluate. And I think with the NSAIDs, in most cases, they can use them very safely, but I also make sure to go over all the potential side effects if they stop eating, there's vomiting, diarrhea, black tarry stool, that they have to stop them right away and get in touch with a veterinarian. Because I think sometimes we know that as veterinarians that they need to, and owners, I think they don't have that knowledge. And so making sure that we really explain all of that up front, and how urgent it will be to contact a veterinarian if those things happen, that hopefully we can all be partners with the care.
Yeah. And also a nice place where if you have some generated handouts on side effects, to
Yes.
look for, it's nice
Mhm.
to be able to send those home. Yeah.
Yes.
So
Yes. It's
this,
usually a lot of info for the owners. And so kind of in one ear
yes,
out the other. So printed,
right.
absolutely very
Yeah.
valuable to send home.
It's valuable to me too.
Yeah.
I'd rather go back and read it later and get a little refresher because I'm guilty of that as well
Yes,
when,
me too.
I have a
Yep.
long conversation with my own doctor. So, um, so that was all my questions. This is fantastic. This article was a great reminder that we really do have more options for osteoarthritis pain in cats than we often, think about. And
Mhm.
so I loved this article. I hope everybody
Thank you.
at home found this conversation really useful, and they can check out the full article at cliniciansbrief.com. That will bring us to the end of our clinical questions. So you've
Great.
been on the podcast before, so you know that rapid fire is coming next.
Oh, yes. I'm ready.
Good. I had to dig deep for these
All
because,
right.
I had to go
now.
back and make sure I didn't ask you something that I've already asked you. Okay, here we go. Would you rather have every bone plate and screw you could ever want right at your fingertips, but dull drill bits? Or would you rather have perfectly sharp drill bits, but never the right implant?
Oh my God, that's like my worst case scenario, both of those. Oh my God, I would probably... Dull drill bits are so hard to work with. Can I sharpen them myself? Can I bring it home and just like
file them
Yeah.
in the middle of surgery? You pull out your file.
Oh my God. I would probably take the sharp drill bits and just make what I had work. Yeah.
MacGyver something else.
Yeah.
Okay. All right. If you had to trade specialties with another associate professor at A&M for a whole week, would you rather be a dermatologist or an ophthalmologist?
Ooh, interesting. I might choose ophthalmology because they also do some cool surgical procedures too. But
Cheater.
If it's the non-surgical, I don't know. Eyeballs are pretty cool. They do like pretty amazing things.
They do. I'm a skin person, so I would have been the dermatologist in a second.
Oh, really? Well, I feel like the dermatology stuff, we joke that we're like the gateway to derm because we have so many animals that have skin disease that need to get cleared up. So I already feel like I have it
before you do.
Yeah.
All right. Okay. Would you rather spend your entire career moving to a new university every single year or be permanently locked into your current position?
Ooh, I'd probably say permanently locked into my current position.
You're happy where you are.
Yeah.
Okay.
I like it here.
Would you rather scrub into surgery without music for the rest of your career or only be allowed to listen to one single playlist on repeat forever?
How many songs are on this playlist?
Oh, I'll give you 10 songs on the
good.
playlist.
I'll take music. Even if it's the same one, I'll take it. Yes. I prefer having music than a silent OR. Yep.
And then final question. If you had to induce Pegasus for surgery, would you put the IV catheter in his jugular vein or in one of his wing veins?
Wow. That one threw me off. I don't know. What surgery? I guess it depends on what surgery we're doing. I would put it in whatever is furthest away from where we're doing the procedure.
That makes sense. Yeah, that makes sense. Wherever it's, I was just going with which one we thought would be easier, but.
Yeah, well, that would probably be the better answer than mine. Yeah.
Okay, that was it. How'd you do? How'd you feel about rapid fire
this
time?
That was good. I like it. I feel like the last one is always like a good question too. Yes, good job.
Like I said, have to dig deep on those.
I love it.
All right. Well, thank you again. I always love having you on the program, and I'm so glad that you could be here with us. And to our listeners, thank you for joining us too. We hope you'll be back for more.
Thank you.
Thank you for joining us for today's episode of Clinicians Brief the podcast. If you enjoyed this episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@vetmedics.com. Clinicians Brief the podcast is a VetMedics production, produced by Alexis Ussery and hosted by Dr. Alyssa Watson.